Pollen allergy. This is probably the biggest make it or break it of all the allergies you may have. If you have a pollen allergy, then you really need to ask some hard questions. These will follow. Pollen allergy, of all the others, let's see. Animal dander, if you don't have a pet, no big deal. Or maybe your pet's getting older. You might kind of minimize exposure. That one we can often live with. Dust mite allergy, fine. Who likes dust mites anyhow? I'll just dust mite proof my bedroom. That's another one that you can really make work. If you're highly motivated, you can do avoidance. Pollen allergy, living in Oregon, that's a tough one. So let's talk about that just for a bit. In review, there are really only 3 treatments for allergy. Avoidance, my favorite. Pharmacotherapy, taking medicines. They're available over the counter, but we can prescribe you different ones if you don't like the ones over the counter, and we can tell you which ones to take if you want to take the ones over the counter. Immunotherapy. Hey, let's cure it. That's why I'm here. So of those 3, my favorite, avoidance therapy, is challenged more by pollen allergy than by anything else. So what I would say to that is that are you willing to not go outside during the allergy season? Keep your windows rolled up in your car, recirculate the air, change your air filter in your house once a month, keep your windows closed in your house. If you can do those things, you might be able to make avoidance measures work. You can certainly give it a try. But let's face it, probably 29 out of 30 people here in Oregon live here because they love the great outdoors. And when does pollen allergy occur? It occurs when things are nice outside. So briefly, if you have a tree pollen that starts in late January, some trees will start in late January and they will continue right up until the spring, early summer. If you have a grass pollen, roughly from April 1st to July 4th, but they do start a little earlier and they do go a little bit later depending on which ones you may have. Do you have a weed pollen? Well, then that's going to get you in the fall. So pretty much, if you like to be outdoors in the winter, like skiing and hiking, you're set. Pollens are fine. You're more worried about, dust mites, animal dander, etc. However, if you like to be outside when it's nice, you're looking at pharmacotherapy that can be timed, or you're looking at immunotherapy to cure you, or what a lot of patients choose is both. So now that you've been allergy tested, we can time your pharmacotherapy. If you have an outdoor allergy like pollen, you'll take your medications in the morning to protect you while you're outside that day. If you have tree, you'll do it in the spring. If you have grass, you'll do it spring, summer. And if you have weed, you'll do it in the fall. And if you have a little bit of everything, you'll do it all those months. Remember, pharmacotherapy will not cure you, but it will help to manage your symptoms. And we can keep changing the medicines till we get something acceptable. For immunotherapy, we have 2 treatment options. We've got either an eyedropper under the tongue, which sounds cool because you don't have to come into our office, but you do have to pay for it. There's no way around it. No insurance company covers sublingual immunotherapy. Or we have what you probably call shot therapy, where you come into our office at intervals, and it's just once a week at first, and then over time it's once every 2 weeks. Then before you know it, you're coming in just once a month. You'll feel like you're playing hooky. And that would be going for a cure. If you go for immunotherapy, you have to be on pharmacotherapy and avoidance therapy until the immunotherapy has been working enough to give you meaningful results. Thank you for undergoing allergy testing at the Modern Nose Clinic. We hope this series of videos has been helpful. If you would care for a link so you could watch these again at home, let us know, and this will be provided to you through your email.